Okay, I can hear and see you now, Mayor.
Well, good morning, everybody. Thank you all for joining us, and hope everybody had a great Derby weekend. It was something that our city was looking forward to, and I think the whole country. I've always said the Kentucky Derby is the rite of spring for America. So to see that be the largest event since the pandemic struck our country, I think gave people a lot of hope about what's possible. And I think, to use a horse racing analogy, we're coming down toward the finish line. We can see it, but we're not there yet. So we've got a lot of work left to do still before we get rid of the pandemic. And we're going to be talking about that in today's program. And even if herd immunity is possible, there's some experts now talking like that might be elusive for us. And so we can talk about what life would look like if the virus is not gone. So lots to talk about here today. We also see uptick in the economy in our city with tourism returning. We're seeing good signs of economic growth. And we know that economic growth and minimizing or getting rid of the pandemic go hand in hand. So it certainly is not an either or. A big part of our positive momentum is more and more people are getting vaccinated. Although we are seeing a drop in the number of people getting their initial doses of the vaccine. We're seeing good follow through on the second dose, but very concerned about the drop in people getting their vaccines, particularly the 20 to 40-year-old cohort. So we'll be talking about that today. Vaccines obviously provide great protection, both for what the original strain of the virus and the variants, but they don't protect you if you don't have it. So they are safe, and we encourage everybody to get out and get their vaccine on. Right now, more than 45% of Louisvillians have received at least one dose, and about 34% are fully vaccinated. So we're making good progress with that. Obviously, the more people that get the vaccines, the more that we can continue to reopen in greater capacity. The Janssen vaccine is back in use. We're going to be talking about that extensively with Dr. Mark Burns here this morning. Obviously, there's questions about that and about vaccinations generally, and we are here to provide the answers today. Also, just remind people, if you got questions, especially as we're getting into the latter stages of the vaccination effort, ask your doctor about the safety of the vaccines and how they apply to you. There's still a lot of misinformation and disinformation flying around about the vaccines, but they have proven to be safe and healthy for all of our population. So again, it's important that everybody gets vaccinated. Let's take a look at the latest COVID-19 data to kind of embed us with where we're at in the reality of the virus. So Dr. Sarah Moyer is going to do that. And of course, Dr. Moyer is our city's chief health strategist and runs our Department of Public Health and Wellness. So Dr. Moyer, welcome.
Thank you, Mayor. Definitely seeing a lot of hope in the community with ample vaccine. And I think confidence is also rising with what you can do once you're vaccinated. But this past week, there were more than 859 new COVID cases identified in our city, which is just far too many. Majority of the new cases were in that 20 to 44-year-old age category, but also were high among 45 to 65 and also 0 to 19. We are still in that elevated alert level orange for COVID. This means that if you are in large crowds or even small groups this past week, and small groups that you aren't normally around, you were likely exposed to COVID this past week. So if you're not already vaccinated, and that's 2 weeks after your second dose or first dose of the J&J, please sign up to get tested today and stay home until you have the results. We reported 9 new deaths last week, and there are currently 114 people hospitalized, or about 6.4%. This is up, going up slightly. 23 people are in the ICU and 16 are on ventilators. And then for vaccine data, 45% of our community has had at least one dose. This is huge. We've had zip codes ranging from as low as 18% to as high as 91% of their community is vaccinated. So that is amazing. And what we know it's slowed, we still have people every day that are getting vaccinated. So if you are one of those, please check out our website and sign up to get vaccinated. Today is the day. Just a few quick reminders that when you're out in public at grocery stores, retail stores, restaurants, sporting events, make sure you're wearing your mask, keeping at least 6 feet of distance, especially around people you don't know their vaccination status, and wash those hands often if you are touching surfaces. The pandemic is not over, and our increase in case count shows that. The minute we let our guard down or get relaxed in our efforts, the virus is ready to rise up and spread amongst our community. And our current status of cases do not reflect Derby weekend just yet. We'll be getting information in the next couple weeks. And then we also know that cases grow exponentially, just like our case count from July 4th. It started out really small, just with a few people infected, but as it grows exponentially and finds more people, that case count grew at the end of July. So we got to be able to test and isolate and vaccinate, or that same thing might happen again. So in the meantime, if you're out during Derby, at Churchill, at a friend's house, there is plenty of capacity in Louisville for COVID-19 testing. So please check out our website, louisvilleky.gov/COVID-19, via that resource center, and find a testing site near you. Testing allows us to track the spread of COVID, and helps us find new variants that are driving spikes in our city, across the US, and across the globe. So if you are in contact with anyone new and you are not vaccinated, please get tested today. Or if you have any symptoms, please also get tested today, no matter your vaccine status. And reminder, if you see the Lou Health COVID-19 helpline flash across your phone, please answer the call. This is 502-912-8598. That is my team calling to tell you that you are possibly exposed. So please answer that call if you are called. Also, just encouraging again, if you haven't received your COVID-19 vaccine yet, today is the day. We have 3 safe and effective vaccines that help protect against COVID-19. Not only do they serve as additional layer of protection, once you're fully vaccinated, you get to get out of quarantine and can attend those memorable moments like Derby, weddings, graduations, sporting events, even if you are exposed. And bonus, they help with lowering the risk of severe complications from the virus, like hospitalization and death. So many great things about being vaccinated. So just if you're on the fence, you got questions, please reach out to your doctor, reach out to your family and friends, reach out to trusted resources like the CDC to get information to help answer those questions, and sign up again. Check out our website or vaccines.gov to find a place near you. And you can always call the Lou Health COVID-19 helpline. Again, that number is 502-912-8598, and they can help get you scheduled. And then just one more thing, we are, as you know, LouVax has gone mobile, and we are looking for more places to host events. So if you are part of a group or an organization, a neighborhood, an employer that has people or know people that are not vaccinated, and you think you can get at least 20 of them, please email us at louvaxmobile@louisvilleky.gov. We are here and ready to help, and just trying to get everyone in our community vaccinated, or at least up to that 91% that one zip code is already. So with that, I know you have a few more questions, but I'll turn it back to you, Mayor.
Thank you, Dr. Moyer. So let's jump up a little bit to kind of the national discussion that's going on about herd immunity. It's just been in the past couple days that CDC and others, Dr. Fauci, are saying, well, there might be some question if we can get to herd immunity in the country. So can you discuss the rationale behind that statement and what that would mean for us in terms of daily living?
So herd immunity, or community immunity, is when a large portion of the community is immune to disease, making the spread from person to person unlikely, as there's no one that's not protected, and so the virus has no place to go. And when it has no place to go, it burns out. And even those that are unvaccinated are protected because there's no virus in the community. And so vaccinations really are key to transforming the virus into a controllable threat. And this is always our goal. We did it with smallpox, and then for other diseases like measles and polio. But we're finding with COVID, much like with flu, the virus is changing too quickly. It's spreading too rapidly right now, and new variants are popping up. And we are a ways off of vaccinating the entire world. So as this continues to spread, whether it's in one unvaccinated community or country, then the rest of us are at risk because as the virus spreads, it changes. And then other variants develop, and then we have to get vaccinated again yearly, like with the flu. Right now, the vaccine is still working against all the variants that we have, but we don't know what the future holds. And so it might turn into more of a flu situation where it's a controllable threat, but still there and something that we deal with year after year. And then we see years when it's worse and years when it's less. So much like with the flu back at H1N1 back in 2009, you all remember, much bigger threat that year, and then flu decreased since then. So that is the newer prediction of what COVID's going to be, something that's part of our life that we can control with vaccination and proper hygiene, hand washing, staying home when you're sick, all those great things is our goal going forward. And the more people vaccinated, the easier that is and the less threat it is for the rest of us and the possibility that we might get to that herd immunity.
Okay. And last week, the CDC issued some new guidance for mask wearing. If you'd like to share those with us or remind us.
So mask wearing, anyone over the age of 2 should be wearing a mask when out in a public setting. Anytime you're traveling on a plane, bus, any form of public transportation. And it's really important that the mask fit properly, which means snug around the nose and the chin with no gaps on the side of the face. And I mean, it's just a good, strong reminder about that. With that, and just how important that is. We've seen flu and other things start to spread as mask guidelines and other things have decreased over the last couple weeks. And so we know other viruses are out there, and masks would do a really great job preventing those from spreading as well, too.
And then outdoor guidance with mask.
So the mask mandate for outside has been lifted for groups less than 1,000. Still recommended if you're not vaccinated and you're going to be within 6 feet of someone to still wear that mask, especially in large group settings. But it's not mandated by the state of Kentucky anymore. If you're having a backyard party with people you know, it's okay to not have that mask on, especially if you know the other people there are vaccinated.
And then finally, on access to the vaccine and availability of the vaccine, are you pleased with where we're at right now? Are there any changes you'd like to see?
We're in a totally different vaccine situation than we were back in January. So now majority of pharmacies, a majority of healthcare providers all have the vaccine. There are plenty of places. And then for some reason, if you can't find access in one of those, Louvax and many of our healthcare providers are willing to go to you. So don't forget, you can always email us at louvaxmobile@louisvilleky.gov to get that set up. You can also go to our website to find one of those places or go to vaccines.gov. If you want to be able to pick which type of vaccine you can get, you can search locations by the type of vaccine in your zip code. And then you can also, if that's too confusing, you want someone to help talk you through it, please call our Lou Health COVID-19 helpline at 502-912-8598. We can help you go through that process as well as get you signed up somewhere to get vaccinated.
Perfect. Okay, thanks. Stand by. I'm sure there'll be questions for you later. So let's talk about another major development in the last few days. And as I said, the temporary pause of in administering the one-shot Janssen vaccine has been lifted by the CDC and the FDA. And so to help us get some clarity on that process and what it means, we're welcoming back our regular contributor and friend, Dr. Mark Burns, who's an infectious disease specialist and associate professor at the U of L School of Medicine. Dr. Burns, thank you for joining us once again.
Thank you for having me, Mayor.
So if you would, just kind of take us back to how all this started. We had, 6 women ages 18 to 48 have a side effect from the Janssen out of the 7 million or so Janssen vaccines administered. So kind of walk us through that, if you would, and then where we're at today and how we got to the point where we're at today.
Certainly, Mayor. I'm more than happy to. Back on April 13th, federal health officials, the CDC and the FDA had received reports of a rare blood clotting disorder among 6 women. This was between March 19th and April 12th. These women had blood clots. Some had blood clots in the brain, what we as medical professionals known as a cerebral venous sinus thrombosis. in combination with low platelet counts or thrombocytopenia. Now, yeah, as you mentioned, there were 6 women. The women were between the ages of 18 and 48, and these problems developed within 1 to 3 weeks after they received their vaccination of the Johnson & Johnson vaccine. Because of that, and what the CDC termed as an abundance of caution, they decided to put a pause on administration of the Johnson & Johnson vaccine. And what the pause did was it gave the panel there, and it was the ACIP panel. It gave them a chance to look at data and to make a determination. Number one, if there were other cases out there, they'd have more information. And number two, to alert providers that if people came in with certain symptoms that and if they were vaccinated within that 2-week period, that the blood clots, particularly the blood clots in the brain, were to be seriously considered, and to evaluate that, and also how to treat that particular disorder.
Okay. So then the FDA, CDC made the decision to resume the Janssen. So what all went into that?
Okay, so on April 23rd, the CDC and FDA convened with the ACIP. They went over the information they had, and they determined that they would recommend the continued use of the Johnson & Johnson vaccine, given that the known and potential benefits outweigh the known and potential risk. They did note, however, that women, and they wanted to make sure that women younger than 50 years of age would be aware of the rare but increased risk of adverse events, particularly the blood clots that I mentioned, and that there are that for women within an age group, there were other vaccine options available for which that risk hadn't really been seen. But the CDC would continue to monitor the safety of this and all the vaccines.
Mm-hmm. Okay. And so let's put that in perspective. We had 1 in a million impacted. And what's the rate of mortality for those million people if they do not get a vaccine relative to potential death from the virus?
Yeah, actually, it was. Yeah, actually, we figured it was about seven out of a million that were vaccinated were actually. It was initially 6. Just so you know, after they went over the data, they found a total of about 15 people that had these complications, but and all were women. But determined it was less than 1% of this chance of this adverse effect becoming about. So again, based on the fact that the risk was so low, again, like way less than 1%, that they felt that the benefit outweighed the risk with that. But again, if anybody was uncomfortable, there were 2 other highly safe and effective vaccines as alternatives to be used.
Mm-hmm. Okay. And then I understand though, but if those million people just decide to forego the vaccine in total, on average, that would lead to about 40,000 deaths from COVID for somebody just bypassing the vaccine already.
Yes, sir, that is correct.
So the message is the same, as to get the vaccine.
Get the vaccine. And if, for example, you're not comfortable getting the Johnson & Johnson vaccine, although remember, initially, it was only 6 people out of almost 7 million that were affected. If a person didn't feel comfortable with the Johnson & Johnson vaccine, there were 2 other vaccines, the Moderna and the Pfizer, that are also safe and effective and did not have this complication associated with it.
So let's say somebody decides to get the Janssen vaccine. Obviously, its benefit is just a one-shot vaccine. What side effects should recipients of the vaccine monitor in case there's any issue they want to report to their doctor?
Okay. Yeah, if any person had received the Johnson & Johnson vaccine within 3 weeks of 3 weeks of receiving the vaccine, they should be looking out for things such as persistent headaches, visual changes, shortness of breath, chest pain, leg swelling, persistent abdominal pain, or if they noted easy bruising or tiny spots underneath their skin. Those would be the things to look out for.
Okay, and then just get a hold of your doctor and make sure you get the proper
Mhm.
advice.
Definitely notify your primary care provider. If you felt it was an emergency, you should call 911 and be seen in the emergency room. Those providers there, again, knowing that you'd received the vaccine within a 3-week period of time, would know what complications to look out for and know how to treat you appropriately.
Okay, all right, well, thank you very much on that. As Dr. Moyer mentioned, we're full bore now with LouVax Mobile, and the reason why we've been able to do that and put more resources in that area is that last Friday was the last day at LouVax at Broadbent Arena, and of course that was the original location where we stood up the mass vaccination effort for our city. Our team did an incredible job there, led by our public health department, Dr. Sarah Beth Hartledge, and their amazing group of volunteers there and professionals, Kentucky Nurses Association, and many, many others who just came through to make that what was a national model for how to do mass vaccinations. But with the changing nature of people that are ready to get the vaccine, we're moving out into the community with LouVax Mobile. And so we've now fully transitioned our operation out there. There are still 2 large vaccination sites available. One is at Cardinal Stadium. That's where this photo is taken right here. They have capacity up to 4,000 vaccines a day. You can either get an appointment or you can just show up. And in talking to people over the last week or so, they felt like that was important information that people needed to know, that they could just show up without an appointment because there's plenty of vaccines available there. So please, think about that. And wherever you're at in Louisville right now, if you said, I want to get my vaccine on, you could drive to Cardinal Stadium right now and be back to where you're sitting right now, probably within an hour, and have your vaccine and be well on your way to keeping yourself safe and your family safe as well. So please remember that. And then the second location that's set up to do some volume is the West Louisville vaccination site at Whitney M. Young Elementary School. So those are the larger vaccination sites. Everything else now is smaller pop-ups in the community or grocery stores and pharmacies, but everybody should have easy access to the vaccine right now. And if you have an organization where you want to have your own pop-up clinic, again, to repeat, just contact us and we'll make sure we evaluate that and get help on your way. Okay? LouVax Mobile at louisvilleky.gov. With that, Kathy, let's go to the questions from the media.
Okay, thank you, Mayor. I only see 2, so if any other of our media friends have a question, please put them in the chat. The first one is from Jonathan Craig and Dr. Moyer, sorry. Good morning, either Mayor Fischer or Dr. Moyer recommend anyone attending Derby who has not been vaccinated be tested. Do you recommend vaccinated people be tested after attending Derby? Dr. Moyer, you want to take that?
Sure. So yeah, definitely recommend anyone who has not been vaccinated to get tested this week, whether you attended the big Derby event or you had a smaller event in your house or neighborhood or went to a friend's house. If you're not vaccinated, please get tested. And then if you have been vaccinated, if you have any symptoms, a cough, a runny nose, sore throat, fatigue, tiredness, any worries that you might have gotten COVID on top of your vaccine, please get tested. But if you have no symptoms, don't need to. But if you have not been vaccinated, please get tested this week.
Okay, great. Thank you. This next question is from Paul Miles, WHAS Radio. The Governor Bashir said we didn't have as many people at the Derby wearing masks as they should. Do you expect to see a spike in cases related to the Kentucky Derby? Dr. Moore, you want to take that one as well?
So we are expecting an increased number of cases post-Derby, and we saw an increase in cases last week. I think even from spring break and people traveling and being out and about more. So hoping that if everyone gets tested this week, or if you can't get tested and you just stay home for 10 days without being in contact with anyone, then we can stop the spread there. But if people are out and about and they have symptoms, or have COVID and don't know it, that's how it spreads exponentially. And so if you go back to the graph on our webpage, kind of what happened after July 4th, when people got together for the first time, after over the summer when restrictions loosened, we saw that big increase at the end of the month. So that's the way COVID works. It finds people that are unvaccinated and doubles every week. So that's our goal to not happen. We just need everyone to get tested and isolate at home, quarantine, and then that will not happen.
Okay, thank you. This question is from Adam Raymond. A question for Dr. Moyer and Mayor Fischer. LMPD says it's not tracking vaccinations among officers. Does that concern you? And do police officers have a responsibility to get vaccinated, given the high contact nature of their jobs? Mayor Fischer, do you want to weigh in on that? Dr. Moyer?
Yeah, the personal health information of our employees is something that we cannot mandate the collection of. We have asked people to let us know if they are vaccinated, and to let us know if they're not, why not, so we can understand what the reasons are. I mean, where we're at right now with folks that are not getting vaccines is for us to, respect that they might have concerns, but understand what those concerns are, and then present the information that can hopefully overcome those concerns. Most of our LMPD officers are younger people. They're in that 20 to 40 age cohort that I mentioned previously that we're having difficulty getting vaccinations with. And we have strongly encouraged LMPD officers to get the vaccine. We have an incentive here at Metro government for people to get the vaccine, and they can take 2 days to get that. And those are paid days off as well. So we're doing everything that we can, that we know of right now, to make sure that everybody that works for Metro, including our police officers, is vaccinated. And again, we would continue to urge them to get vaccinated and let us know any questions that they have so we can answer those questions. Dr. Moyer, would you like to add anything to that?
I think you covered all of it. Just wanted to chime in and add that I think everyone in our community has a responsibility to get vaccinated. And so really hope with everything that we're doing, trying to increase access, trying to share the great medical knowledge from people like Dr. Burns, that people start to feel more comfortable with that and sign up today to get vaccinated.
Okay, thank you. This question is from Tori Gessner. Have you had much interest in Luvax Mobile from groups around the community? How many pop-ups has Luvax Mobile hosted? Dr. Moyer, you want to take that?
I don't have the exact number, but we have had a fair number of interests. We've had more than 2 sites booked every day in the past few weeks and coming up. And so, but we do have the capability to do more as our healthcare partners as well transition from doing mass sites to being able to help us out. We can do more and are willing to do more. So if you are interested, please email us and we will get a site set up with you. If we are full, we will find someone who can come out quickly and do that.
Okay, thank you. From Paul Miles, WHAS Radio. Dr. Moyer, the 859 new cases last week appears to be the highest since early March. Is that correct? Why the spike? Do you expect the increase to continue?
So 859 is the highest since early March. That is true. And I lots of reason with the spike. I mean, I think you all seen it. I've seen it. People are relaxing their COVID protocols. And hopefully that's because they're vaccinated, but some people are not. And more sporting events are happening, whether community or school related. Also seeing people travel more. And so that spread post-spring break is starting to increase exponentially as well too. So do expect that to continue to increase unless we can get more people vaccinated today and staying home if they are at risk, so that spread stops.
Let me bring Dr. Burns into that question as well, because Dr. Burns, is part of the reason why we're seeing a little bump here is that the variants are more present in the community, and these variants are more infectious than the original strain of the virus?
Yes, Mayor. Yes, Mayor. I think so because these variants, particularly the B117, is 60% more contagious than the original wild type. So yes, sir.
All right, thank you for that. I think you had a little audio problem there, but I think what we're learning through the data is these variants are roughly 60% or so more infectious and about 60 to 70% higher mortality as well, right? And so those are some facts that we want people to know that have not been vaccinated to understand that, and Dr. Moore, correct me if I'm wrong on this, kind of the longer you wait to get vaccinated, the more dangerous this virus gets. Is that an accurate portrayal?
That is accurate. I mean, every day the variants continue to spread and change and mutate. If you, I mean, the virus, COVID's main goal is to replicate and spread to other people. And so if it finds ways, it finds variants that do that better, it sticks with those variants to do it more. So the best way to protect yourself is to get vaccinated and continue to wear that mask and the spacing and the hand washing. But we're finding that just those measures aren't working like they used to.
Okay, thank you. This question is from Dennis Ting. Dr. Moyer said turning COVID into a controllable threat is like what we're looking at right now. Is there any chance of reaching herd immunity at our current rate of vaccinations? Dr. Moyer, you want to take that?
Sure, I'll start and then I'll turn it back over to Dr. Burns as well. I mean, if you look at our website, we're doing about 10,000 new vaccinations a week, which is down from about over 30 that we were doing in prior weeks. So at our current rate, it'll take us all summer to reach that herd immunity amount. So hoping that people are looking for information, getting those questions answered, and are deciding that today's the day to get vaccinated. Dr. Burns?
Yes. Something to that. Just to, I apologize for sound issues. But the fact that vaccine hesitancy has been one of the problems. So if we could overcome that and just vaccinate as many people, we may not get herd immunity. And as Dr. Fischer said on numerous occasions, but we will try to get as many people vaccinated as possible.
Okay. Now, sounds like I'm echoing as well. Okay, last question from Dennis Ting. If and when the FDA allows for children 12 to 16 to receive the Pfizer vaccine, is there a plan for children to get their shots here in Jefferson County? Will it be given out via schools, pediatricians, and clinics? Dr. Moyer, can you take that?
Yes, so very exciting. I think we're hearing rumors that the FDA might approve Pfizer vaccine down to age 12 by the end of this week or next week. And so if you have kids between 12 and 16, get ready for that. So the Pfizer vaccine, unfortunately, is the hardest one to manage and give. Is the one that needs that really cold freezer and comes in groups of over 1,000. And so it's harder for it to be in pediatricians' offices because of those requirements. But all of our healthcare providers, our U of L's Mass site, almost all the vaccine that Norton is giving out is Pfizer. And so check out our website for those places, as well as check out vaccines.gov to find out who has that Pfizer vaccine and schedule an appointment. Some of the pharmacies have it as well, but it's less likely to be in each individual pediatrician's office right now because of those requirements. I think some of our bigger healthcare systems are able to do that just because they can split up those 1,000 doses among multiple providers, but it's a lot harder for the independent pediatricians' offices to have that vaccine because of the amount it comes in and the requirements for freezer and refrigeration.
Okay, thank you. And that's our last question.
Okay, well, thanks everybody for joining us today. And it seems like we're always in a new stage with the virus and with the vaccines. But I think to summarize here, Janssen's back in play, fully safe and accessible for women under age of 50. We're recommending precaution in that area. Second is we have seen a downturn in our city in terms of new vaccinations, particularly amongst the younger cohorts. So we encourage them to get out and have safe and easy access to the vaccine. It's throughout our community as well. So we're just in a different stage of combating the virus right now. And we're starting to see the reopening of the economy as well. So we've got to balance all this out, and we're still at war with this virus. So it's not done with us. So again, everybody, please get your vaccine as you can. Follow the masking guidelines, especially when you're indoors. We're getting into our warmer summer months right now, but we're far from over. And it's the first time we were having a conversation in the country about potentially not reaching herd immunity and living with the virus. And of course, all of us would prefer that's not the case. And it's up to each and every one of us to make that decision on how we can make sure that we're safe because we've gotten the vaccine and we're keeping our families and friends safe as well. So with that, we thank everybody for joining us here today and look forward to catching up with you later in the week. Take care.